Today, our chair was called away. So if you could please look at the agenda, members, you will notice that we were supposed to be starting with the Kansas Guardianship Program, but because our Veterans Affairs Office representatives have to leave early, we're going to begin with them. So let's start with Mr. DeBoer. If you would introduce yourself to committee.
Definitely, thank you. My name is Martin DeBoer. I'm with Legislative Research, and I'll be discussing the budget for the Kansas Commission on Veterans Affairs Office. You should have a hard copy in front of you as well as possibly a digital copy online. The way I'm going to do this, I'm just going to give a quick overview. You will be making recommendations in a couple of days on the 10th, so please take a chance, take time to review it because I won't touch on everything in this budget analysis. So on page 1, you have a general overview of the budget. We focus on expenditures when we're discussing the budget for the agencies. The first page gives you a general overview of what the agency does, as well as an executive summary of what is within this budget. The next few pages give you some highlights as well as fund statuses. I would like to begin on page 7 for the fiscal year 2022 analysis for the agency's budget. So at the top of the page, you'll see a table. This table outlines what the legislative approved amount is, any adjustments made by the agency, and then the governor's recommendation. The numbers you see within that table correlate with the language that is written down below. So if you look at the table, you'll see there were no changes. You'll see their adjustments and then the governor's recommendation. Below the table, there were no adjustments to the legislative approved amount from fiscal year 2022. So at the bottom half of the page, the agency requests a revised estimate of $26.8 million. This includes $6.5 million from the state general fund. This is an all funds increase of $5 million or 22.7%, and an SGF increase of $863,000 or 15.3% above the FY22 approved amount. Part of their request includes funding from the American Rescue Plan Act for the Veterans Hospital and the State Hospital. This is $2.2 million from all funds that go to the hospitals, $1.2 million of that for the veteran home and $960,000 for the soldiers home. These are one-time expenditures and can be used for operational needs with the expiration date of September 30th of 2022. There is a Consolidated Appropriations Act funding. This is a one-time funding of $355,000, all from federal funds. And this is to the existing state extended care facilities for veterans to prevent and prepare for, on the following page, a response to the COVID-19 pandemic. Number 4 is the Winfield Columbarium Wall. They received federal funding to extend the federal wall from the National Cemetery Administration grant, and this is for the Winfield State Cemetery. They do have a supplemental request for temporary staffing. The agency is requesting $500,000. All from the SGF for anticipated expenditures associated with the effects of COVID-19 pandemic on skilled nursing staff. They have a supplemental request for the restoration of the Veteran Services Program funding. So this includes $85,130 from the SGF, and this is to fund 5 FTE positions, which they already currently have. They are currently vacant in the Veteran Services Program, and these were held vacant due to the agency's reduced resources budget from last year. Number 7, we have a supplemental request for architect fees related to a new veterans home. So the agency is asking for $250,000 from the SGF to pay for an architect to assist in the initial application process to build a new veterans home in Northeast Kansas. They also have a request for funding for an informational resource manager, and this includes $36,625 from the state general fund to hire that position. They also have a few other adjustments, and they all minor adjustments across multiple expenditure categories. The agency estimate includes 373 FTE positions, and this is the same as the FY22 approved amount. Bottom of page 8, you'll see the governor's recommendation. The governor recommends $29 million. This includes $6.5 million from the state general fund for FY22. So this is an increase of $2.1 million or 7.9 above the agency's FY22 revised estimate. Down below, you'll see what that additional funding is. You have the Arpa 24/7 pay plan base increase, and that includes $284,386, all from the Federal American Rescue Plan State Relief Fund. And this is for permanent increases of the base pay of nursing staff and at the veterans homes. You also have from the same pay plan, a shift differential, and this includes 1.8 million, all from the Federal American Rescue Plan State Federal Relief Fund, and this is for increased hourly rate in certain circumstances and bonuses to salary positions. At the very bottom of the page, the governor does recommend the 373 FTE positions, which is the same as the agency's revised estimate. With that, I will stand for any questions on FY22.
Committee, are there any questions? Senator Thompson.
Thank you, Madam Chair. For the ARPA funds, we're using that to increase pay. So when those go away, we're going to be having to fund those pay increases, correct?
Well, this is a 2-year plan that was brought by to the State Finance Council by the Spark Committee. So we will see this continue to FY23. So this specific plan is only for 2 years. And there are milestones within that plan that if they hit certain thresholds, the pay gets reduced and things like that. So the agency, the director is here, William Turner, and they can clarify any questions that you have on that.
I just want to make sure we're not going to get stuck holding the bag with some federal funds coming down and then, whoops, pull it out. Thank you, sir. Thank you, Madam Chair.
Are there other questions? Senator Baumgardner.
Thank you, Madam Chair. Thank you for being here today. Let's start with the 373 FTE in the governor's recommendation. Are there any of those positions? I understand that that's exactly the number of positions this year. What of those positions are vacant or haven't been filled?
I believe the agency can give you more updated numbers, but I believe in my most recent conversations, they're about 65% staffed at this time.
Which means 35% of those positions haven't been filled.
Correct.
Okay, I think that as a committee, could you do some research and find out what was the vacancy rate year prior? Because one of the things that we do know is agencies consistently have a number of FTEs and they consistently have them vacant. It simply means more funds in there. And I guess that leads me to the question, because this interim session, when we had joint corrections and juvenile justice, when the Secretary of Corrections was meeting with us, they were looking at pay increases or bonuses coming from vacant positions. So it's interesting to me that the ARPA 24/7 pay plan base increase of $284,000 would come out of ARPA funds rather than just the funds that are already budgeted in the agency with a 35% vacancy. So could you find out what the vacancy was perhaps last year and the year prior, and also find out for us what that funding base would be for that 35% vacancy? Madam Vice Chair, my second question has to do exactly when you were addressing Senator Thompson's issue about when we use ARPA funds, 2 years later, those funds are no longer available. And you mentioned that if certain benchmarks were met, that the pay would be reduced. Do the employees understand that this pay bump up would then potentially be reduced? And what would those benchmarks be that would cause a reduction in pay?
As committee, as to the benchmarks, I can get that information for you. I don't have those specifically here. As for if the employees are aware, that'd be a question for the agency. The agency is in charge of communicating that with their employees.
Yeah, and sometimes that doesn't get communicated. I think it's also important to understand what those benchmarks are, because we know benchmarks can be counterintuitive. Like, it's going to be reduced if we increase, if we decrease the position vacancy rate. So how do we make sure that we don't reduce pay? Well, we don't fill those vacancies. Last question is on item 5, also on page 8 that you addressed, and that was that supplemental temporary staffing. So they're wanting $500,000 of SGF. Why isn't that a Spark request? I guess you might call it an Arpa request. And quite frankly, why aren't they simply paying it again out of that 35% vacancy rate?
Yes, Chair and committee. To that point, I don't know. This was requested within their budget submission for the year.
Oh, I understand. I think it's just important for us to look at, what we're looking at is a 7.9% increase. We have areas, agencies in this state that haven't seen increases, so it's almost an 8% increase, and it's 2.1 million. And as long as we're looking at a vacancy of 35% of the FTE positions, you know, when I look at that, let's see, we are looking at more than 100 positions that are vacant. That's a lot of positions to be holding that we're not filling. So I appreciate the research that you can get for us.
And Madam Chair and committee, I would like to make a note that just because you see vacant positions in some of these agencies doesn't mean that they're always funded. So they could have FTE positions available to them, but the funding has not been provided for those vacant positions. In this case, I can do some research for you on that, but
I don't think that we can, Madam Chair, I'm sorry. I don't think that we can have FTE positions and not have them funded. You would have to have those funds encumbered in some manner. Otherwise, they should simply be, if they're unfunded, they should be removed from the agency. Thank you, Madam Chair.
Committee, are there other questions? Yes, Senator Petty.
Thank you. Thank you, Madam Chair. And just as a reminder, on these positions, on this funding, this added 2.1 million, this has already gone through the Sparks Task Force. It was recommended by the Sparks Task Force, and it has been approved by the State Finance Council.
that is correct.
Thank you.
I do have a question. Committee, are there any other questions from the members? Okay, my question is regarding page 11, and we see the governor's recommendation that you went through on page 8. Could you address page 11?
Yes, most definitely. Page 11 addresses fiscal year 2023, and I have not gone over that yet. If you would like, I can start on FY23 if there's no more questions on FY22.
I think we're ready. Thank you.
Thank you. So I will start on page 10 to give you a little bit more background before we reach the governor's recommendation. The top of the page, you'll see a similar table with agencies. Revised estimate for 22 is where we start with this, then any agency's request and the governor's recommendation. So right below the table, you'll see that the agency requests 24.4 million. This includes 9.3 million from the State General Fund for fiscal year 23. And this is a all funds decrease of 2.5 million and an SGF increase of 2.8 million from the FY22 revised amount. Below that, you'll see that they have a capital improvement adjustment. So this includes any capital improvement expenditures, and it reflects grant funding that expired in FY22 that do not carry over into 23, and the completion of any projects that do not carry over. Just as a side note, capital improvements are all on the last page of this budget analysis if you would like to review. The enhancement request, they do have a request for revenue shortfall, and this is an amount of 3.2 million from the State General Fund to protect against estimated revenue shortfall from the Veterans Home and the Soldiers Home. And this is a result from lower than expected census numbers, and this reduces their federal funding that they receive. They have an enhancement request. Again, this is for the restoration of their Veteran Services Program. This includes the $340,000 to fund the 5 FTE positions which they had previously for their Veteran Services Program, and this is a continuation of their request in FY22. They have a request for the funding, again, for that Information Resource Manager position for FY23. That is $111,239 SGF for the Information Resource Manager, and they will supervise existing IT staff, develop standards and guidelines, and deal with federal regulations. And that is also a continuation from FY22. On the following page, on top of page 11, there's a catch-all of all other adjustments, and here you'll see that there was a reduction in federal funds that were received prior in FY22 that ended, but then you'll have the Arpa, from the Arpa and the Consolidated funds, and those don't carry over into FY23. Again, the agency request includes the 373 FTE positions, which is the same as the FY22 approved amount. Middle of the page, you have the governor's recommendation. The governor recommends 25.5 million. This includes 10.4 million SGF for FY23. This is an increase of 1.1 million or 4.4% above the agency's FY22 revised estimate. So here again, you'll see year 2 of the 24/7 pay plan for both the base increase and shift differential. I would like to note that here in fiscal year 23, they are SGF funds. They are not from the federal funds. You'll see the enhancement revenue that the governor does not recommend, the revenue shortfall enhancement of $3.2 million. You'll see that the governor does recommend 2 additional positions within the agency. The governor recommends the agency add a director of public information, and the funding for that is $97,500, and 1 FTE position to hire that position, as well as director of operations. And this includes funding of $116,250 and all from SGF and 1 FTE position to hire that position. So the governor's recommendation includes 375 FTE positions, and this is the 2 FTE positions above the agency's request. And with that, I'll stand for questions on FY23.
Do we have any questions for the conferee? And Senator Gossage, thank you for filling in while I was tardy. So Senator Gossage has a question.
I do, thank you. I'm trying to understand on number 4 on page 10, it says the agency's enhancement request includes $111,000 SGF to hire an information resource manager, but yet that's in the budget for year 2022, and that amount at the time was 30-some thousand, if I remember correctly. Can you tell me
Yes.
the difference between that?
Yes, Chairman and committee. So any funding we look at FY23 is for the entire fiscal year of 23. We are already currently in FY22, so it would just be for the remainder of the year when that funding is approved, so that funds that position for the remainder of FY22. That's why you only see partial salaries and wages expenditures there. And in FY23, that's the total funding for 1 full year of that position.
So we're already into 2022, I understand that. So once the funding is approved, when would this person be hired?
That would be for the agency that through the application program process and when they find a candidate that they deemed qualified for that position.
Okay, so whereas the assumption is then the person will not be hired until 2023? Because it's saying hire them. That's what's throwing me off.
Yes, so when we're doing a budget, if something has not already been included or approved, and we have to note that the funding has to carry over. So we can't include funding for 23 in the 22 request. So since we're doing the budget for 22 and 23, we have to just identify that they need certain funding in FY22 and in FY23. When we see the request next year, if that position is approved, that will already be incorporated in their overall request, so you won't see it broken down again.
Thank you. And then my next question, if I may, Mr. Chair, is on 9 and 10 on page 11. Could you explain to me maybe, do you understand how that works with the governor's recommendation that the governor is saying, you need to hire a director of public information for $97,000. I'm recommending you hire a director of operations for $116,000. Is this typical that a governor just says I think you need these positions?
Well, so just a little bit of background on the way the process works, is the agency compiles a budget and a lot of information, and that is submitted to the governor and to us, saying this is what we request at this time. There are conversations ongoing between the agency and the governor, so this might be something that was brought up in conversations between the 2 agencies, and feel like, okay, the governor felt she should include this in the agency's request. So timeline-wise, the agency submits their budget, and then the governor reviews that and then makes any adjustments, and there is communication between the agency and the governor's office during that time. So it's not uncommon to see the governor include things that the agency didn't request, because at the time, the agency may not have considered that or felt that, they weren't going to get that through.
Thank you. And my final question is, on page 10, agency request 24.4 million, including 9.3 of SGF funds. And then this says this is an all funds decrease of 2.5 million. Could you explain that?
So all funds incorporate anything that's not SGF. So that's federal funding, fee funds, and any kind of other revenue or expenditures that's created that is not SGF. So in this case, some of their federal funds and grants may have lapsed or not continued into FY22. So you can see an overall fund decrease due to the ending of grants, federal grants and things like that. But because of the 24/7 pay plan and the other recommendations, the other enhancement requests, you'll see the SGF increase.
So this would kind of go along with what Senator Thompson was saying about if these funds start to drop off, the state has to make up the difference.
Well, yes and no. It is my understanding that, Senator Thompson, you were referring to the 24/7 pay plan with the federal funds. That's specifically that one item. So in that one item, for FY22, they are federal funds from the state, from the federal, Arpa federal fund. In FY23, those are SGF funds. So, the two-year plan, there, the state is covering from the SGF, the funding for that. In this case, where we're seeing an all funds decrease, you know, those grants are designed for a specific purpose. And building a new wall or new, you know, construction, or, you know, there's something going on with federal funding to prevent for COVID. And once those programs end, then the agency either, there's two options, they stop or they do come back and ask for more funding.
Okay, thank you very much. Thank you, Mr. Chair.
Okay, not seeing any further questions. Martin, thank you very much.
Thank you.
BJ Turner, Executive Director. BJ, welcome to the committee.
Thank you, sir. Good morning, Mr. Chair, Madam Vice Chair, Madam Ranking Member. I appreciate the opportunity to be able to appear before you today to help kind of maybe offer some context a little bit into what we are doing in the Kansas Commission on Veterans Affairs. And you've already heard I think, an excellent rundown of the numbers and as they're presented there in the governor's recommendation for our budget from Martin. But again, I'd like to just offer a little bit of context on the organization. So first, if I may, thank you all very much for your service. Thank you for leading your leadership here in our state. And I know you're wrestling with a number of complex and critical issues for the state, and I appreciate your time this morning. Again, if you'd heard the numbers, I would like to highlight, I have a chart that I have offered you, and I'll make sure that I get the electrons to your staffs to make sure that you had that as well for the record. And I will refer to that here in a moment as I kind of go through this presentation, if I may. I'll start with, we have in excess of, based on the most recent census, a little bit over 196,000 veterans in our state of Kansas. And when you add on, or when you can make the assumption that of those 196,000 veterans, you can probably safely assume that there are 1 to 2 family members, dependents that are associated with each one of these veterans, likely either located here in the state or maybe somewhere else, you know, in the country or throughout the world, that are also supportive of those veterans and receive benefits and are kind of recipients of that support that for their veterans. So you're talking upward now of 400 to 500,000 people that are affected by the policies and the benefits and the services that we're able to provide these veterans. Our veteran population is a broad demographic. They come from, you know, there are veterans that have served in World War II, Korea, Vietnam, Desert Storm, and it extends into the most recent conflicts that we've experienced in Afghanistan and Iraq. So you can see there's really quite a broad spectrum there. Probably about 45% of our veterans are now kind of from the Vietnam era, if you will, the ones that we see mostly. And then close behind that are your peacetime or post 9/11 veterans now that have served over the last probably 20 to 30 years in service. Again, so our organization, the way we are organized, just to kind of maybe to reacquaint some folks with how we are organized, I guess I must start off with, I was recently appointed in this position in August of this past year, so I've kind of been going about trying to learn the organization, learning about state government, getting acquainted with all the people that work with us, and trying to get out and meet with as many veterans and various veteran support organizations as I can across our state. But our organization is organized with Veteran Service Representatives Program, where we have 19 veteran service representatives that occupy about 15 locations geographically dispersed across the state to support veterans and their families. We have a cemeteries program that oversees and manages and operates 4 state veteran cemeteries throughout the state there. And then we also have 2 state veterans homes. And we are in the kind of the early preliminary stages of going through the process of planning for and requesting an initial federal grant to support the building of a new Kansas State Veterans Home in Northeast Kansas. So with each of these, the way we look at it with these programs is and then you'll see now on the chart, if I can, I'll make reference to this, is starting on the left, we've had these, our veterans that have served in a number of these conflicts and they've been asked to do some pretty tough missions around the world throughout their time in service, whether they served a couple years, 2 or 3 years, or if they served 20 or 30 years. They've been asked to do some pretty tough missions in tough locations, pretty destitute places, dealing with a number of different cultures and different people. And now it's our mission basically here in Kansas to support them and to create an environment in which they can thrive and they can continue to be valued members of our society here in Kansas. They still have a lot to give in many circumstances, and we want to offer them the optimal opportunities to be able to do that. So you can see that on the left-hand side. In the center portion, you'll see 4 lines of effort. The top one is kind of a double arrow there, represents our main effort, if you will. And the main effort is kind of signified by the human capital that you invest there, the resources that you invest there. So most of our FTE and the people that we have working within our organization are dedicated to support those 2 state veterans homes. And a lot of the dollars that we receive, so as you heard earlier, and Martin was discussing our dollar amounts there in the budget, I guess to your point, ma'am, that we have probably 80% of our budget comes from other funding sources, be it the fee funds, from the federal VA, from Medicare, from Medicaid to help support that. And so as we go about doing that, there's a certain fixed cost, obviously, to run these organizations, and our FTE doesn't necessarily ebb and flow with that. So we have this kind of a base operating cost there to run our homes. What does happen is the census or the population within the homes. And right now we're at about 160 between the 2 homes. That can fluctuate. And over the last couple of years, that's been pretty tough business due to obviously the COVID environment and what we've experienced. There was a period of time there for safety and security reasons that we stopped admittance into the facilities. And as such, you can imagine the census kind of fell off there somewhat. It is somewhat stabilized here probably in the last 6 or 8 months, but not necessarily growing by any measure right now. And we are continuing to work through those challenges. And so some of our numbers we may have, as we try to predict out in the future, we do have plans for, and we want to optimize our ability to be able to go out and recruit and allow people, to know about what our homes can do and how can we offer them that service. So that continues to be one of our challenges right now, is to get that word out and to go out and to make sure people know about these things and that they can take advantage of them. So that said, the staff that are there are doing just miraculous work in my mind, in my opinion. I've been out to see the home several times, and the 65% staffing strength that we're at, or the 35% shortage, is largely attributed to the registered nurses, the licensed practitioner nurses, the CMAs, the certified Medicare or Medicaid people, and the CNAs, certified nurse assistants. So that's where a lot of our degradation staff is, ma'am, that we have. So these folks are just working some tough hours and tough conditions, in some cases where COVID does find its way into our facilities or amongst the staff. There are instances where they have to go off and create, if you will, a COVID wing. And so now you have dedicated staff, and that limited number of people you have are now dedicated working in a COVID area, not to be intermixed with the other areas, which causes more stress and strain then on that staff and the leadership at these homes. They also are having to then rely on temporary agencies, as you all are well acquainted with, well aware of. In many cases, their charges may be 3 and 4 times what our ability is to pay our professionals, the caregivers that are in our facilities. So we are constantly wrestling with that and going back and forth. And so some of the funding, and that's where a lot of the $500,000, ma'am, comes from in terms of that request, was related to that. So as we have certain FTE that are on the books there that we are trying to hire people against, and in some of these places that are in Winfield and out in Dodge, the population of available critical caregivers, these professionals, is somewhat limited. And as they're kind of competing with other nursing homes and facilities, competing with these temp agencies that offer, choice of hours, choice of locations, and the various monetary benefits. And as they do that, there may be, there's cases then where we are having to pay, more funds then for these temp agencies. And so what happens is I get reports on a weekly basis that measure, our ability, how we are using these temp agencies, how we're employing these various staffs. And I would tell you that probably 35 to 40% of the weekly hours are being filled by temp agency staff members. And we are working hard to try to reduce that where we can to mitigate that stress. And the 24/7 facilities pay plan has helped to mitigate some of that stress, as you'll get fewer people that want to call in now and not report for work because they know they have to be there to receive those funds. They have to report for duty and to do the work there. So there are some positive things that we're beginning to see. It's far too early in the process right now, given when this went into effect in the end of December, to give you any really significant numbers or trends. We have received increased inquiries for people that want to come work there, and we are working through that and how we can recruit and retain these folks. Again, while I'm on that topic, just again, ma'am, to your point about, how do we recruit and retain them? And I will assure you that we are working with our superintendents and our leadership there to continue to coach these folks, that the differentials that are in effect are temporary in nature. They are not there. The base salary increases that they received are, but the various differentials that are associated with that are temporary in nature right now. The one that's probably most prevalent, the threshold, is if you are a critical shortage facility, that top differential, I believe is differential 4, that is the one that, continues that we measure. So as we are able to acquire staff and retain them, that's the one that may be that, would possibly would have a chance to go away then at that point. But we do talk to them. It is a constant dialogue. It is a challenge, yes, ma'am, but we are working through that to do that. And so as Martin described, those dollars were funded by Arpa, that 2.1, I believe, million, 2.121 million. And then in the 23 request, it's being recommended that that's inclusive in our budget going forward. The second line of effort there is about assisting our veterans in claims and benefits, and that really stretches beyond just claims and benefits. We touched probably over 40,000 veterans last year, of those 196,000 veterans in the state, or 40,000 veterans and family members seeking help, seeking advice, looking for employment opportunities. They look for any number of things. And so in those 40,000 engagements, if you will, that probably averages about, you're talking 5 hours per person to come in there, to come in with one of our veteran service representatives out there that are operating across the state, to engage with them, to learn what their issues are, to build a case to help them out. We've submitted about 6,092 cases this past year in 21. And again, the other, you say 40,000 people, but only 6,000 cases. Well, in some cases, you're helping with powers of attorney and other administrative type things to help out these folks. Also, a part of that you'll see in the blue there is our cemetery services, and that's about providing dignified and respectful memorial services for our veterans as we put them to rest in their final resting place there. Martin did talk about it. We were very fortunate to receive the federal grant for the new columbarium wall. We broke ground on that in November. We expect it to be done here in the April-May timeframe. There'll be no degradation in service, no interruption in service to those that desire to have columbarium wall interment. So we're very, very happy about that. And many thanks there to the National Cemeteries Administration and to the construction folks and to the weather that's contributed, quite frankly, to help get that underway and to get it completed in a timely manner. Number 3, we work with the Governor's Military Council.
Brigadier General, I apologize for interrupting, but We had a full schedule, and I was told that if we did these budget hearings, each one would be 15 minutes.
Roger, sir.
We're in 35 minutes of a 50-minute session,
Okay.
and we still have business to
Understand.
attend to. So if you could
sir.
wrap up, we would be greatly appreciated. And I do apologize, after looking, I figured out BG was not your name, it's Brigadier General. So I apologize for that.
Yes, sir. Yes.
Sir, thank you for your service, and I
Probably explains
apologize
why
for.
we're talking, sir. I'm sorry.
So I apologize for not being astute enough to pick up the initials when I introduced you, so thank you.
Not at all, sir. And I can end there. My point is just to try to offer some context into the number of services we provide. So it's a broad spectrum of services about assisting folks. It's about memorial services. It's about final resting places. There's about 160 folks in these homes, over 196,000 veterans. So you can imagine we have 195,840 plus veterans out there that require services and assistance and opportunities where we can help with homelessness, employment opportunities, job skills. And so that's why we see the importance of having somebody with Director of Operations that can help us provide that, those ties into the legislative services and ties to other state agencies, federal agencies, private partners to help us integrate them and synchronize their efforts to get what they need to the right place. So that's where I'll end there, and I appreciate your time and welcome any questions you may have.
Thank you. Committee, do we have questions? Senator Baumgartner.
Thank you, Mr. Chair, and thank you so much for your presentation, Brigadier General. Thank you for your work. Quick question as far as the differential, and I'm very familiar with Winfield, lived there for 7 years, love the community, but it's a fairly isolated community. And so you're going to have some folks from Arc City, but I understand that demand of getting healthcare workers. So talk to me briefly about the shift differential. I don't think the shift differential is what those of us customarily familiar with shift differentials in hospitals. That's not what this is, where a 7 to 3 shift gets this pay, 3 to 11 gets this pay, 11 to 7 gets a much higher pay. Is it, or am I wrong on the differentials?
Man, we have used, that's one of the mechanisms that we use to help, again, with the retention and recruitment of these folks is so those that are working less desirable shifts, we have incorporated some shift differentials. They are not to be confused with the differentials that are part of that pay plan, though, man. These are levers that we have used trying to help with those folks that are pulling shifts, like you said, that are less desirable, and that if it's the 2 in the afternoon to 10 in the evening, and then the 10 in the evening to 6 in the morning shifts. Yes, ma'am.
Okay, thank you very much. Thank you for your work.
Okay, not seeing any further questions. Thank you very much. And committee, we are planning on taking this up on Thursday. Did someone say something? Oh, I'm hearing things. PG. So Thursday, I do understand Dayton and Jean will be here Thursday to answer any questions. Since we're running low on time, would it be acceptable if we move your hearing and work that budget to Thursday? Okay, thank you. And Brigadier General, thank you very much. Committee, we will now move to working Senate Bill 381. And I do believe we have some amendments, so as we wait for Jenna to pass them out. Nope. Oh, we need, okay, I'm getting ahead of the game here. So do we have any amendments for Senate Bill 381? Senator Stefan.
I do have an amendment, and I think Jenna has copies for us to pass out. Chairman, may I describe it?
Yes, you may.
In regards to the first page of the bill, basically, what we did was we struck out every reference to pharmacist through lines 7 and 8, lines 14, 17 through 22, line 25 and 31. And then on on page 2, we added, well, and it shows up at the bottom of the back page, we added into an existing section there at the end of paragraph N, we added, unless such prescription is being used to treat or prevent a COVID-19 infection. And again, in no way is the intent of this amendment to remove the responsibility of the pharmacist from verifying, validating, and authenticating the prescription. It merely is to isolate out the assumption of a diagnosis and to make sure an appropriate prescription can be filled. Thank you.
Is that your motion? Okay.
Yeah, yes.
Do we have a second? Senator Thompson seconds. Any discussion on the Stefan Amendment? Senator Holscher.
Thank you, Mr. Chair. I do have a question. So with this amendment, what would happen then is, through the bill, a pharmacist would be required to fill the prescription, and they would be liable. The pharmacist, as well as the physician.
I think it would be treated the same as any other prescription that is filled. The pharmacist still has the inherent responsibility to verify, validate, and authenticate. Yes, to the part that any legal indemnity has been taken out of the bill, as I had said that would be the other day when we heard the bill.
Okay, so clarify for me, because you said, I think it does. So let me make sure I asked it correctly. So the bill with the current language indicates that if a physician writes a prescription for an off-label medication, the pharmacist is obligated to fill it. With this new language, the liability falls on both the pharmacist and physician if something goes wrong?
With the wording in my amendment, the responsibility of the prescription falls just like it does on every other prescription that's written.
So both the pharmacist and the physician?
The pharmacists inherently do have some responsibility in verifying, validating, and authenticating a prescription correctly, yes.
Senator Thompson.
Thank you. Yeah, obviously, my big concern is these things are going to be filled. Do you think there's any way, I know there's some pharmacists who might be hesitant to fill these prescriptions, these particular prescriptions, ivermectin, hydroxychloroquine. Do you think this gives us any teeth to protect that prescription when it reaches the pharmacy that's not going to be denied?
Well, I do. I do feel like we made it perfectly clear that they can't refuse to fill an appropriate prescription based on an either known or unknown or assumed diagnosis. So I do. I think if they validate, authenticate, and verify, and then don't fill it, they're violating state statute.
Okay. I'm just worried. I mean, some of these people are following CDC guidance only, and that's my big concern. But no, whatever we can do to make sure these people can get these medicines and give these doctors the latitude they need, because this is the final nail in the coffin if we don't give them some protection. So,
Literally.
yeah. Thank you.
Senator O'Shea.
Thank you, Mr. Chair. So my question, the part that says unless the prescription is being used to treat or prevent COVID-19 infection. So what's the process for when the script is turned in? Would the physician need to detail that this is for COVID-19? Would they need to disclose what it's for? And is that normal practice?
I think with the wording of the bill, they don't have to disclose it because in nowhere in the pharmacy laws or the physician-based statutes is the diagnosis for the prescription mandated. And I've never written, to my knowledge, I don't ever remember writing a diagnosis on a prescription before. What's been occurring is the pharmacists have been making the assumption of what the diagnosis is.
So, Mr. Chair, if I may follow up, could the physician argue that any drug is being used to prevent COVID-19 infection?
I do still think you do refer to a standard of care, and the standard of care is clearly defined in the Association of American Physicians and Surgeons, is clearly defined on Frontline COVID-19 Critical Care Association. The standard of care for early treatment and the medications used is clearly defined in the literature. This doesn't carve out any freestanding willy-nilly prescribing that did not already exist in the Kansas statutes.
Jenna?
This would allow for the prescription of anything with the exception of controlled substances as they are defined in that criminal statute.
Senator Petty?
Thank you, Mr. Chair. And this actually is a question for Jenna. Jenna, as I'm looking at the amendment, on line 16 on page 2, well, I guess actually line 20, where it says section 2 of KS has attachment 1, then it says it's hereby, section 3 is hereby repealed. And then could you go into that detail and also then to section 4? Thank you.
Yes, thank you, Mr. Chair. Jenna Moyer, Office of Revisor of Statutes. That is the language that's in every bill. When we add in a section of law, the 2020 Sup 1637, that version of the bill as it exists in current law would be repealed and replaced with the version of the law that's adopted in the amendment. It's just the regular repealer that we do every single time we have a bill. It repeals the current one and replaces it with the new one in the bill.
And just to follow up with that, then on the addition that's added into this attachment, that unless such prescription is being used to treat or prevent a COVID-19 infection, so that goes along with what you just said a moment ago, and that anything that's being prescribed, if the prescriber says is treatment for is to treat or prevent a COVID-19 infection would then be have to be filled.
Thank you, Mr. Chair. Again, Jenna Moyer, Revisor Statutes Office. So this bill is the pharmacist, sort of what they have to follow when they fill a prescription order. The subsection N allows a pharmacist to not fill something within their professional judgment and discretion. Basically, I don't think this is a good idea. And this added language would say that they could not exercise that discretion not to fill a prescription if that prescription is being used to treat or prevent a COVID-19 infection. The pharmacist would still be required to make sure that it's a valid prescription, that the patient actually exists, those sort of checks that a pharmacist would usually do.
Senator Holscher?
Great, thank you. And I think I heard this, Jenna, question for the revisor. The bill is not limited to just 2 drugs, correct? Okay. And then, maybe this is for Dr. Stefan. Can doctors already dispense these medications?
No, they cannot dispense these medications. They can write a prescription for them. Pharmacists dispense, and that's where the problem arises. Doctors are making compacts with patients or agreeing on a patient treatment plan, and then when the prescription hits the pharmacist in multiple circumstances, they are choosing not to dispense the medication, thus the bill.
Senator Baumgartner?
Thank you, Mr. Chair. I believe this is for Jenna, our revisor. We do know that the University of Kansas Health System does have a pharmacy service. Their services are for both patients and non-patients. So would this amendment address those pharmacists, or can a system overrule this particular amendment and require their pharmacists to comply with what they, as a system, have established for dispensing of medications or prescriptions?
Thank you, Mr. Chair. Jenna Moyer, Office of Revisor Statutes. So I need to make sure I understand your question correctly. Obviously, for University of Kansas, that's across the Missouri line, this would not apply if you're practicing in Missouri. And then your question is, if the hospital can say,
It's in Kansas.
well, there's some that is over the line that wouldn't apply to them. For those within the state of Kansas, it would apply. Your question is asking if a hospital can say, don't follow this?
If a hospital system can say that those pharmacists are not to follow this legislation.
The hospital systems are not addressed in this bill, but if the actions of a prescriber were to not follow this law, then an action could be, I mean, there's not a penalty specified in the bill if you weren't to follow it. So that would just be the usual course if you weren't to follow a bill, that action could be taken against you as a pharmacist.
Thank you. Thank you, Mr. Chair.
Senator O'Shea.
Thank you, Mr. Chair. I would like to suggest a substitute amendment.
And what is your substitute amendment?
Okay, so it would be the same thing unless such prescription is being used to treat, so essentially be unless it is two drugs, ivermectin and the hydro drug. Yes, so it wouldn't be, so right now it's any drug that was said, we're using this for COVID-19, it could be anything. I'm suggesting it just be those two. Thank you, Mr. Chair.
Okay. We have that motion on the floor, second by Senator Petty. Do we have any discussion on this motion? Senator Stefan.
Thank you. Again, I referred to the protocols in existence at this time, and there are multiple medications, lots of medications being used to treat COVID-19. So to unnecessarily limit this doesn't work, doesn't make sense. It takes away the effectiveness of this bill. I'll be voting no against in regards to that amendment.
Jenna?
I just want to clarify the amendment that we are making for the committee. Would this be to change the language in the insert instead of saying unless such prescription and say unless the prescription for ivermectin or hydroxychloroquine, and then also amending in the section 1? Okay, so that would change the language in section 1 to strike the including but not limited to. And so then it would read, the prescriber may prescribe a prescription drug approved for off-label use to treat COVID-19.
Senator Stefan.
Thank you. The very core of this problem has been this shutdown of investigation, this one world order treatment plan, which really initially for early treatment was nothing. And there are other medications. There's fluvoxamine, which has incredible results in treating early COVID. And so this amendment would literally continue to shut down the investigation and refinement of our early treatment of COVID-19. Thank you.
Seeing no further questions. Senator O'Shea.
Thank you, Mr. Chair. I'm open to, never mind, thank you.
And just, Jenna, maybe for clarification, my understanding of the amendment is that they could still reject it if there is a allergic reaction to another medication. They just cannot use COVID-19 as the reason for rejecting the prescription.
Dang, I was really hoping there's someone from the Board of Pharmacy in the audience, because I'm not an expert on this particular statute. But if the language that it's amending is related to the pharmacist's professional judgment and discretion, it's my understanding that The ways that this is typically used would be for like the morning after pill, certain things like that, that the pharmacist could, within their discretion, not fill it. And this would, the substitute motion, or substitute amendment would say that you can exercise that discretion and judgment unless the prescription for ivermectin or hydroxychloroquine is being used to prevent COVID-19. So if it were for hydroxychloroquine or ivermectin to treat something else, the typical, parasitic infections, et cetera, the pharmacist could still use their discretion, or for any other medication.
Senator Stefan, and we are running out of time, so if we hope to work this, we've got to hurry. Okay. Any other discussion on this amendment? Not seeing any. All those in favor say aye.
This is a substitute amendment.
On the substitute, correct. On the O'Shea substitute amendment. All those in favor say aye.
Aye.
Those opposed, no? No. The noes have it. We are back on the motion to amend Stefan's amendment. Any further discussion? Not seeing none. All those in favor say aye. Aye. Those opposed, no? No. The ayes have it. Do we have any other amendments? Senator Stefan.
I would like to make the amendment that we take SB 398 and take the contents of 398 as an amendment to this bill.
We have a motion on the floor by Senator Stefan to insert the contents of Senate Bill 398 into Senate Bill 381. A second by Senator Baumgartner. Any discussion on this motion? Senator Holscher.
Can we get a refresher of what SB 398 does, please, from the revisor? Thank you.
Jenna.
Thank you, Mr. Chair. Jenna Moyer, Reviser, Statutes Office. Senate Bill 398 was requested for introduction in this committee, and it would, so for childcare facilities or schools, there's a typical list of vaccinations that are required in order to attend the school, and the current law allows for a religious exemption, and this bill would not allow the childcare facility or the school to inquire into the sincerity of those religious beliefs. So if you were to want to put your child in one of these facilities and say, we do not have this vaccination because of our religious beliefs, the facility could not inquire into the sincerity of those beliefs. This would be similar to the legislation passed in the special session for employer requirements for vaccine mandates.
So if I'm understanding correctly, a parent could say that their child cannot get a vaccine for religious reasons. It can't be questioned. Is that
As long as it fulfills the statutory requirements, it has to be in writing, things like that.
so they just have to put it in writing that their child cannot get the vaccine because of religious reasons?
That it would violate their sincerely held religious beliefs is the wording in the Senate Bill 398.
Has there been a hearing yet for this bill in the House, the Senate, or?
There has not been a hearing. It was referred to our committee on January 28th. And I don't know if there's a House version of it.
Okay. I'll be objecting to this because there has not been a hearing on it. I am quite sure there are professionals out there, healthcare professionals, who would have issue with this particular provision, and we've not allowed a hearing or allowed that opposition to be heard.
So noted. Senator O'Shea.
Thank you, Mr. Chair. I would just echo those statements. I think I want to follow the system that allows us to all really understand what we're voting on before we vote. Thank you.
Senator Petty.
Thank you, Mr. Chairman. I totally agree. This is vastly expanding what we're talking about here. We've had a hearing on this bill that we're working today, and I think it's very imperative that we really look into something, particularly when we're expanding into childhood vaccinations.
For those of you listening online that are getting the interpretation that this is something unique in committees, it is not. It's something done every session. This just happens to be on a certain bill, so I don't want you to be misled that this is something unique. Senator Thompson.
Thank you, Mr. Chair. I don't see the problem with this at all. All we're doing is reaffirming the people's religious rights as enshrined in the state constitution of Kansas, which is very, very broad. It's why we passed it in the special session, and it gives parents discretion as to whether or not they want their kid to take a vaccine that is actually dangerous and has been proven to be, these kids are not at risk. This just gives them an option, and so that they send them to daycare, and that daycare requires a vaccine, that just puts these parents in a horrible position. This makes total sense, and I will be very supportive of this.
Senator Petty.
I think this is a perfect example of why this bill deserves to have a hearing. We are talking about vaccinations of our children, and we're talking about the safety of all, and we're not talking about religion. So I think it's important that we keep it in the right context. We have regulations in place for that very reason, so that we don't have outbreaks of measles or diphtheria within our daycares, our schools. So that's why this bill deserves to have its own hearing.
Senator Stefan.
Thank you. Again, this bill takes the exact same exemption language that was passed in the special session and brings it over to another area of the Kansas statutes. It creates predictability, it creates synchrony, and it's only fair that the exemption covers the varying scenarios and different age classes of our citizens. And as Senator Thompson said, it does give parents the opportunity to avoid putting their child in a dangerous situation. Thank you.
Senator O'Shea.
Thank you, Mr. Chair. This is not just COVID-19 vaccine, it's all childhood vaccinations. And for us to not even have time to fully read the bill and be asked to vote on it is bad policy. Thank you, Mr. Chair.
Any further discussion on this amendment before we take it to a vote? Not seeing any. All those in favor say aye. Aye. Those opposed, same sign.
No.
Motion carries. Does anybody wish to have their votes recorded? And I apologize, I did not ask last time there were some no's. Do you guys want those no's recorded as well? Okay. Senator Erickson.
Thank you, Mr. Chair. I move to replace the contents of House Bill 2280 with Senate Bill 381 as amended and designate as Senate substitute for House Bill 2280.
I have a second by Senator Baumgartner. Any discussion on this motion before we take it to a vote? Senator Holscher.
Yes, I'd like to ask the reviser to give an overview of what that does and what now we are looking at as far as a complete bill. Thank you.
Jenna.
Thank you, Mr. Chair. House Bill 2280 was amendments to the State Board of Pharmacy, and the contents of that bill were passed in a conference committee report. And I gave the chair a sticky note that told me which one it was in. It passed in Senate Bill, the contents of that bill passed in Senate Bill 238 Conference Committee last year. And so it's essentially a shell that's in our committee. And so what would be passing out would be the contents of Senate Bill 381 as amended, which would include Senate Bill 398.
So the two bills essentially, 398, 381, if I got my numbers correct, put into that shell. Okay, and then for clarification again, that second one, 398, it's not just COVID vaccine, correct? It's all vaccines?
Thank you, Mr. Chair. Yes, it would be all of the requirements typically required, or all of the vaccinations typically required to go into a childcare facility or a school. There'd be things like the polio, measles, meningitis, rubella. There's a list of about 14 or 15, I believe. It's in regulations. I'd have to look it up, but I could get it to you.
So if I'm a parent and I've got a little kiddo that I'm taking to daycare and I say, I don't want my child to have any vaccines to attend your facility,
Based on your religion.
based on your religion, then that is what we're saying here, that's what make that legal.
Then the exemption would be allowed.
Just to make a clarification, Jenna, correct me if I'm wrong, there already is a religious exemption. All this does is say you cannot dictate to or ask about my religious beliefs and exemption to satisfy that religious exemption.
It's all vaccines.
All vaccines. Any further discussion? Not seeing none. All those in favor say aye. Aye. Those opposed, no. Would anybody like to have their vote recorded? Okay, so noted. Senator Erickson.
Thank you, Mr. Chair. I move to pass out Senate substitute for House Bill 2280 favorably for passage.
Have a motion on the floor by Senator Erickson to pass out Senate substitute for House Bill 2280 as amended. A second by not as amended, it's a substitute, so not as amended. And second by Senator Baumgartner. Any discussion? Senator Holscher.
Okay, so my understanding is we now have a bill that, based upon religious beliefs, allows children to not get any vaccines to attend a daycare facility as long as it's in writing. And then the other part of the bill is in regard to the writing of prescriptions and dispensing of prescriptions for the treatment of COVID. My question is this, back to that original bill we started on. Is there a statute, Jenna, that prohibits the writing of and filling of prescriptions for off-label medications currently? I don't believe there is, but.
Thank you, Mr. Chair. To my knowledge, there's not a statute addressing off-label prescriptions for prescribers generally.
Okay. And the reason I asked that is because a number of good people from Kansas indicated they needed that initial bill to be passed to be able to get ivermectin or whatever else off-label it was to treat situations, but that's not actually the issue. Pharmacists can already write that. I'm sorry, physicians can already write that, and pharmacists can already fill it, if that's correct. And I do have from various pharmacies indicating that they have been filling prescriptions. So I guess the whole question then is why is that bill even really needed if it can be done? So I'll go ahead and jump ahead here. The other day we were told there was hardly any opposition to this bill. There was a very narrow time frame for opposition testimony to be submitted. In about 3 days' time, I got this much opposition testimony. This is maybe half of what I have that was collected even with a couple more days. The access to the off-label medications is there, and physicians can write that prescription, and pharmacists can fill them. So again, the core of the bill is interesting in that respect. This is a very dangerous bill. It was dangerous before. It's even more dangerous now with what's been done. We have 3 branches of government.
Senator
So there's
Holscher,
checks
I'm
and
going to
balances.
interrupt for just a second here. You're getting a little off course. You've misread the bill or misconstrued what the bill says, but it doesn't address legalization of off-label prescriptions. 20% of all prescriptions filled today are off-label. The crutch of the underlying bill, was that the Board of Healing Arts were investigating doctors for prescribing off-label drugs. And the Board of Pharmacy was coming down on some pharmacists for filling off-label drugs in this case. That is the crutch. There is nothing dubious or life-threatening in these bills.
Okay, but.
And on your child care scare, it's already statute, already law, that they have religious exemptions. The only thing we're changing is that you cannot question what my religious belief is. That is the only thing we are changing. So there is no scare. We're not adding anything and changing anything except for those things. We're clarifying. So with that, all those in favor say aye. Aye. All those opposed, no? Would you like your voice or votes recorded? Okay, that passes. Thank you. We are adjourned.